The key to any type of surgical technique is the appropriate instruments and the ease of use of your instruments. This in my left hand is an Adson forceps, and it does have this small tooth on it, which is appropriate for any type of primary wound closure because it allows you to grab the tissue very easily. The needle driver just takes a little bit of practice with opening and closing, but the better you get at that, the easier your suturing will be. When you are initially putting in your first suture, you want to grab the tissue with your forceps, and then you want to insert that needle at approximately 3 to 5 millimeters away from the wound edge. And most importantly is you want to put it in at a 90-degree angle. When you do that, you insert the needle and then you rotate your wrist to bring the needle out of the center of the wound, just about 2 millimeters, possibly 3 down the wound edge. When you do that, by putting the needle in at a 90-degree angle, it allows the tissue to evert instead of invert upon itself, and this promotes wound healing and decreases scarring. Once the needle is through the opposing side, you pull the suture through, and then you use your tissue forceps to reload that needle. When you're loading your needle, you do want to do that approximately 2/3 down the needle. You want to try to stay away from the tip of the edge of the needle because that can break your suture, and you do not want to touch the tip of the needle on the opposing side because that, of course, will dull the needle and cause increased difficulty with pushing the needle through. Once you have your initial throw on the opposite side, you grab the tissue on your side or the near side, and you insert the needle at approximately the same depth as you exited on the opposite side. When you do that, you again want to come up at a 90-degree angle, and so you bring that up, ensuring that you are approximately the same distance away from the wound edge as you are on the opposite side. Sometimes that tissue is a little bit more dense, and in order to ensure that the needle comes up at a 90-degree angle, you do have to utilize your forceps to push the skin tissue down while you are pushing it through. Once you are through, again, you grab the needle with your needle driver, and then it is highly recommended and appreciated by your nursing staff if you secure your needle as you are pulling it through, just to ensure that that needle is in sight and not going to cause any needle punctures or needle sticks. Once you have the suture pulled through, you can release that needle, just making sure that it stays within visual field and not close to anyone that is assisting you. You do want to leave approximately a 1-inch tag on the opposite side. This allows for easy grabbing with the needle driver. In order to start tying your knot, you want to put the needle driver in the center of the two suture materials, and then you want to wrap the suture around the needle driver 2 times. This is called a surgeon's knot, and it allows you to secure the suture down across the wound edge. Once you have your 2 throws across the top of the needle driver, you do grab the opposing tag on the opposite side, and then you use your left hand or your non-dominant hand to remove the suture over the top of the needle driver and pull that across the wound edge. When you do that, you can see that there's a nice secure initial tie across that wound edge, approximating those edges very nicely. If you come through the opposite side, you can see that that does not lay flat across the wound edges. You want to try to avoid that. So once you have that nice secure knot laying flat across your incision, you put your needle driver back in the center of the wound, and then you want to come across the needle driver once, grab the opposite side of the suture, and pull that snugly. This allows you to approximate the wound edges and secures your knot. Then we do just offer a little bit of extra support by going back and doing this one more time. You do wrap the the suture across the needle driver, grab the opposite edge, pulling across the wound. You do not need to do a double throw after that initial because the wound is already, the knot is already secure. Then you put the needle driver back in, rotate across the top of the needle driver, grab your suture edge, pull it through, and lock it down. And now you have a nice interrupted suture across that wound. When you're cutting your edges, you do want to leave approximately 2 to 5 millimeters again of suture so that you can find it easily when you're trying to do removal. Once you have that initial stitch in, that does offer a little security, and from that point you just continue to repeat the process. Again, loading your needle at approximately 2/3 down the needle drive, grab the tissue, insert your needle at 90 degrees, rotating the wrist to bring it through the center of the wound, releasing the needle driver, and using your tissue forceps to reload. Grabbing the near side, coming in at the same depth as you are on the opposite or the opposing side, bringing up at the same distance across the wound at a 90-degree angle. Release, secure your needle, pull that suture through until you have approximately 1 inch of suture remaining on the opposite side. Do your initial double throw or your surgeon's knot, 2 loops around the top of the needle driver, securing the edge of the suture, pulling across that wound edge so that it's nice and flat across the edge. Do not lift the suture up, as that will loosen your knot, and then you will not have a secure knot. Lay it flat. Do not pull too tightly also, because that can cause a little ischemia. So honestly, you just have to pretend like you're Goldilocks. Everything has to be equal and symmetric and just right, not too tight, not too loose. Come across again the top of the needle driver, grabbing your your suture, locking it down, and you can do this as many times as you feel comfortable in order to ensure that that knot is secure. And then cutting your suture. And that is an simple interrupted suture technique.